please pop them in the chat. Let me know. I'm here to make this the best learning experience possible for you guys, which is really why I have added in the Kahoots at the end. Okay. Also, if at any point we have some friends that are joining in, if you guys can help me out by adding them in, that's super, super appreciated. So let's begin. The first thing we're going to talk about is how we can help promote adequate nutrition within some of our populations of concern that might have some barriers to adequate nutrition. So, a lot of our focus is going to be on our oncology patients or our cancer patients, okay? Essentially, we do want to do some vitamin and mineral supplements for patients that do have these deficits. For example, our cancer patients we need to be focusing on. Our older adult patients are patients that have malabsorption issues. We want to make sure we're doing a full history, okay? Additionally, this goes into more of our med portion of this review, but even if your patient is an oncology patient and they're on vitamin C supplements, folic acid supplements for your pregnant moms, we need to be taking into consideration what in the world are they taking. I don't care that they're just taking ACE inhibitors. I also care that they're taking, vitamin and mineral supplements. Okay. When patients are in the hospital, whether it be for trauma, for burns, etc., this most often contributes to protein deficiency. So we need to specifically be monitoring our patient's serum albumin levels. This is going to give us a good idea of how well nourished they are. It's also going to let us know if our enteral or parental nutrition is working for these patients. Okay, examples of nutritional supplements can include vitamins A, D, B12, calcium, and iron. Up next is going to be our iron deficiency anemia. It's very, very common in females, pregnancy, etc. And what we're going to see with these patients is some fatigue, lethargy, pallor, cold intolerance, headache, and tachycardia. Unfortunately, we can't always see these symptoms in children because they're not able to tell us, Mom, I feel fatigued. Dad, I'm really lethargic. But we might be able to see some other subtle signs and symptoms, such as lack of interest in play, that they're not running around during recess, that the teacher is saying they're having a hard time paying attention. This is all what our clinical findings of iron deficiency anemia are. Okay. Therefore, we want to focus on foods high in iron, okay? Iron fortified foods have extra iron in them. This can be really great for our infants if we have formula that is iron fortified, and also some cereals. A big thing I want you guys to know and remember is that consuming vitamin C, whether that be in tomato juice or orange juice, with your iron supplement tablet will maximize absorption. So if your patient is, we've identified that they might be deficient in iron based on the clinical findings, what will help? Vitamin C helps. Okay. And here's a great list of some foods high in iron for you guys. All right. So when we're talking about planning for a patient at risk for malnutrition, I already talked a bit about looking at their serum albumin or their pre-albumin levels. So ideally, we want to keep it above 15. 15 and above is our normal. However, when we start getting to 10.7 or below, we are malnourished. Okay, and we'll see all these clinical findings associated. It's up to us to kind of figure out and ask the questions, why might this patient be pretty malnourished? Is it a cost issue? Is there maybe an underlying medical condition? Do they need to be switched to TPN? Supplement drinks like protein shakes between meals can be implemented, etc. But really, how do we assess for malnutrition? in addition to, the physical findings we might see, we're also going to order some labs on these patients, specifically your albumin and your pre-albumin levels. So it is recommended to understand those normal values. Okay. All right. So now we're going to talk a little bit about oncology, and really, in addition to treating the disease, what are some other things we really have to be cognizant of and aware? So usually your patients that are receiving radiation end up being pretty dehydrated. So it's important we ensure adequate intake of liquids. Also, with radiation, diarrhea is a really big side effect, and that can also contribute to this dehydration. So we're going to give them fluids. We're going to encourage oral fluid intake. If we need to do some IV fluids, that's okay too. But we talked a lot about this in our GI review, but what can we do for patients with, a lot of diarrhea? We're going to decrease roughage. We are going to do low fiber. So any of those traditional health foods that are great for your gut, like flax seeds, chia seeds, and lentils, while those are very good for the normal healthy person, it's not really recommended to someone who's having a lot of diarrhea, because that's just going to go straight through them. Okay, it's going to exacerbate the issue. Instead, we want to eat foods high in lectin. Okay, um, these will really, really help with that diarrhea. Specifically, pay attention to your citrusy fruits. Okay. Also, we all know caffeine and fatty foods are not good for patients that are having diarrhea. Additionally, some other issues why a patient receiving radiation might have some alterations in nutritional status include just because food really just doesn't taste good to them anymore. They'll report foods tasting really, really metallic, or they'll have a really hard time just tasting things. So, what can we do? If their food is tasting metallic, we're probably going to give them some plastic silverware. Remember, also with radiation patients, they need their own cutlery. Okay, they cannot be sharing plastic or metal forks, knives, spoons with their family, because they can kind of transmit some of that radiation to them. So we are going to opt for plastic cutlery. Additionally, we're going to have them to put as much spices, seasonings, anything on that food so they can actually taste it to make it a little bit more enjoyable. Mints, candy, and gum can also help. What's really interesting is we can also sweeten their meat, okay? Like the little cranberry sauce with turkey on Thanksgiving. That's actually really good for these patients. We really want to give them whatever they want to eat. Same thing with our cancer patients. What diet should they be on? Whatever they want. We're just going to try to get food and calories into them. Okay. All right. Now we're going to kind of break away from more oncology portion. We're going to talk about heart healthy diets. I see I have a question in the chat. Well, let me look at that. So for the interventions of patients receiving radiation, should we avoid pears or not? I believe that slide I put pears twice. I think it was this slide, avoiding pears. I believe that I'll have to double check on that for you. It's definitely a typo on my end, on whether or not pears have high fiber content. So if you want to check what the fiber content of pears are, we can do that. But really, we want low fiber, high pectin foods. Okay, so if you want to double check and put it in the chat, do pears have lots of fiber, or do they have lots of pectin? All right. All right. Now we're going to talk about nutritional concepts for heart health. Okay. So we've all heard about our DASH diet. We know we want nothing in the pantry, nothing that's canned. But remember, these patients that usually have hypertension or other cardiac diseases, it's not overnight did they become hypertensive. Not overnight did they develop coronary artery disease. It was a progression. So Same thing overnight, we're not going to get rid of all the salt. So ideally, we want to start titrating their salts from about 2,300 to 1,500. Okay. Um, Really know how to identify your foods that are high in salt. Are they canned? Are they from the pantry? Are they processed? Even just salt seasoning, we really need to be looking at that. Also, low fat dairy products usually are pretty low in sodium as well and high in calcium, which is great for these patients. We really also want good, healthy foods, reducing alcohol intake, and really just understanding what they need to avoid and what are better swaps. Do we want harsh salami? Do we want thick cut smoked salami? Or do we want maybe some lean fish or lean sodium free turkey? And just remember, they're not going to be able to do this overnight, but they are going to be expected to be on a progression. What is a way that we as nurses assess if they're following their DASH diet? We're going to do daily weighs. Okay. If all of a sudden they gain 5 pounds in a day, it's impossible to gain 5 pounds of fat in a day. It's water. What holds on to water? Salt holds on to water. Therefore, in addition to teaching them all the things they should be eating, we also need to be teaching them on doing their daily weighs. Okay. All right. The recommended cooking fat is actually going to be liquid oil. Remember, canola oil in place of butter is really, really good for these patients. We talked a lot about saturated versus unsaturated fat, but just remember, butter is solid at room temperature. We do not want foods that are that are solids at room temperature in the oil realm of things, because that's not the healthy fat that we want. Okay. So instead of lard, which is just butter, we want to be using oil. Okay. Um, Additionally, going back to our pear question, pears are pretty high in pectin. So if your patient is not having, they're also very high in fiber. So if your patient is not having lots of diarrhea, and we just want to promote, nutrition and what that, pears are a good portion, but we just really got to be seeing what's going on with that patient. But don't worry too much about the foods. It's more general considerations of, okay, flax seeds have a lot of roughage. We want to avoid roughage and follow the brat diet. So focus more on your brat, your bananas, rice, applesauce, and toast. All right. Now we're going to talk about our glycoside and diuretic considerations. Okay. So basically, we're going to talk about your patient is on a medication. What are our common medications where we need to tell a patient to either avoid a food or eat a food? So for patients that are on a non-potassium sparing diuretic, they will be excreting high amounts of potassium. Therefore, we want to encourage them to increase their potassium intake to prevent hypokalemia. What are our clinical findings associated with hypokalemia? That is going to be, they're going to have that decreased deep tendon reflex, really lethargic, muscle weakness, etc. So this is also good to know high potassium versus low potassium foods when we talk about kidney care. Okay, so for a patient that is on a diuretic that is not a potassium sparing diuretic, we're going to teach them to eat high potassium foods such as prunes, papaya. Any of our dried fruits are really high in potassium, things that we would find in like trail mixes and whatnot. Additionally, avocados, tomatoes, milks, bran, nuts, and seeds. For a patient who is taking a statin drugs, these drugs help lower cholesterol, but they're not a cure-all, end-all. Meaning, just because you're taking a statin does not mean you can eat all the cholesterol you want. That's not how it works. So we're going to teach them to have a low cholesterol diet. In addition to this low cholesterol diet, they need to be frequently monitoring their cholesterol and triglyceride levels, okay? About 2 to 4 weeks after, and then periodically. So also, please review what is your normal cholesterol panel. That will help you to ensure that the patient's dietary modifications are working. Or maybe they say, I've been eating very, very healthy. I've been eating these lean meats. I haven't been eating chips. I haven't been eating burgers. I haven't been eating fries. And then you look at their cholesterol panel and their total cholesterol is 250. Something's not adding up. So maybe we need to educate a little bit more on some good, healthy foods. And we take these drugs at night with our evening meal. Very good. All right, now we're going to talk about nutritional considerations for patients with a GI disorder. You guys should also be pretty familiar with some of our other GI disorders, but remember, GI is from the mouth to the bottom. So, starting up top, we've got dysphagia. So, a person with dysphagia and difficulty swallowing, number one, we always make sure we do a bedside swallow study to make sure that they're able, well, not to make sure, but to assess their ability to swallow. If they do have dysphagia, we're going to thicken their liquids, okay? We don't want water, we're going to have to thicken their water, okay? Additionally, when we're talking about food, it really just depends on what the patient is presenting with. Is this mild dysphagia or is it severe dysphagia, okay? Um, Level one, this is kind of as pureed as we can get. You put all the food in a blender, there's no chunks, so they don't have to swallow down chunks. We can also move into mechanically altered to advanced. Okay, it's going to be a progression. Usually, patients that have had strokes or any other issues like that will have some dysphagia we need to assess for. For a patient with celiac disease, they must completely eliminate gluten. I often see this one missed a lot because a lot of us forget to recognize that gluten includes soy and wheat, and it also includes malt. So please remember we want to avoid wheat, rye, and malt. Additionally, beer has these things in them, so they're not going to be able to drink beer. Okay? So please, please, please don't forget that. All right. For a patient with dumping syndrome, essentially we learned about this, but all that happens with dumping syndrome is we've had too much sugar moving too quickly into a stomach that is too small, likely post gastric bypass surgery or post stomach resection surgery. So what happens, these patients are very sweaty, they have lots of tachycardia, hypotension, lots of diarrhea, lots of abdominal cramping. It's overall not a very good experience for these patients. If your patient is exhibiting these signs and symptoms and they are on an parental nutrition, we want to slow down their rate of feeds. Okay, what are we going to teach them to do? Please eat small, frequent meals that are really high in protein. Specifically, ideally, we want low carb. Okay, no concentrated sugars, so no fruit juice, no candy, no ice cream. We don't want to drink liquids with meals. That's going to speed up the time it takes for food to reach, the stomach. We also teach them to lay down after meals. We teach them to lay down after meals because it's the same thing like someone with a Crohn's exacerbation. We put them on bed rest simply to slow down the food transit time, if you will. That's also what we do for patients with dumping syndrome because we are trying to slow the transit. Why? Because fast transit is what's causing this dumping syndrome, okay? Also, these patients' milk is not very good for them. Milk is usually high in a lot of sugars. Gastric bypass surgery can be done for patients that are obese, and all it does is it reduces the size of the stomach. That's also why dumping syndrome is really, really common in your gastric bypass surgeries. What we need to know for dietary teaching post-op is that we start after surgery with a little bit of liquids, okay? A little bit of protein shakes. We're not chugging the whole thing at once because remember, we took the size of the stomach from being this big to being like this big, okay? So we're going to start out with liquids. We're going to see how they tolerate. Then we're going to do soft foods. And most importantly, we want small, frequent meals that are high in protein, low in carbs, and also very high in vitamins and nutrients. These patients don't have a lot of space in their stomach to work with. So, do we want them filling up on Oreos or do we want them filling up on nutrient dense foods? We want the nutrient dense foods. Okay. All right. For patients that have constant constipation or some other GI issues, whether it be IBS with constipation, we're going to teach them to identify foods high in fiber. This is also very good for your patients who underwent anesthesia or who are on medications that can constipate them. So, what foods are really high in fiber? Whole grains, fruits, specifically the skin of fruits is very, very high in fiber. Vegetables, broccoli, and flax seeds. All right. Now we're going to talk about some nutritional concepts for diabetic patients. So, what populations are more at risk for diabetes? Really, we have a lot of our Hispanic, Latino population, African Americans, Asian Americans, and a lot of the link to this disease development is the cultural foods, events, and barriers to nutrition. So you'll learn a little bit more about this in your public health nursing, but it is up to us to identify these barriers and issues and kind of work with them while respecting their cultural preferences. What are some healthy alternatives? Okay. The manifestations of hyperglycemia, this occurs when the blood sugar is too high, and I like to call this the hot, dry sugar high. They are very, very hot. They will not be sweating. They feel very warm. They are irritated. They have a very, very bad headache. Okay. And they'll also be very, very, very thirsty. Okay. This is what happens when a diabetic patient is having too much sugar and inadequate insulin to kind of help lower their blood sugar. It's very important we catch these signs early on before they start to progress to diabetic ketoacidosis, which can lead to coma, heart attack, etc. When we're identifying foods with the highest glycemic index, these are foods that are going to raise glucose pretty darn quickly. What are our very, very high glycemic index foods? Our baked potatoes and our pastas. Okay. Also dates. So understand that our high carby foods are going to raise a patient's blood sugar a lot faster and a lot more than things that are usually high in protein or other vitamins such as nuts and seeds. And this picture is here for you guys. Something such as sweet corn has a glycemic index of 54, so we're going to teach these patients to avoid sweet corn, okay? Meanwhile, we also want to educate, hey, our broccoli, our cucumbers, those might be a better option for you, okay? Now we get to talk about some special dietary considerations. So, when we are performing a cultural assessment about fastings, most individuals that fast do so for religious purposes. For example, Islamic patients fast during Ramadan. Usually, some Catholics refrain from meat consumption and they do limit some meals. But it's really just important to ask your patient about what their dietary restrictions are and kind of include that in a plan of care. If you notice you have a patient that's participating in Ramadan and food service comes in to drop off food, maybe you can grab that food and set it aside for later. You can also help them order food after hours or save food after hours for them and make sure that if they're not eating meat on Fridays, when their meal tray comes, that there's no meat on their meal tray. But in a nutshell, it's always very important to ask your patient because they might not even participate. Okay. Up next is our phosphate binders. If you remember, a lot of our patients with our kidney disorders, kidney dysfunction, chronic renal failure, they need to take phosphate binders. It's most important to note that they have to take phosphate binders with meals. If they don't, it's not going to work. It's not going to do anything. But like I said, medication is not a one-stop shop. It's not a one fix, they also do need to reduce their overall intake of phosphorus foods. So, what foods are high in phosphorus? Specifically, nuts, seeds, milks, whole grains. Really, we're going to teach them to avoid those. Okay. Um, how do we know our phosphate binders are effective? How do we know they're effectively eating a low phosphorus diet? We want to be looking at their serum phosphorus level. Ideally, we want less than 4.5. Okay. And we all know that weird relationship between calcium and phosphorus and how they're just fun elements. If we lower our phosphorus level, this actually helps make our bones big and strong. So, when we're talking about a lacto-vegetarian diet, this is your traditional vegetarian diet. I know in ATI there's a lot of different, oh, you have your lacto-vegetarian, your vegetarian, I don't even know if they call it vegan, but with a lacto-vegetarian diet, this includes vegetables and dairy products. It will not include meat and eggs. This is what we typically call our vegetarian diet, okay? No meat products, but they are okay with milk and dairy. So just keep that in mind. Now we're going to talk about nutritional concepts for fluid and electrolyte imbalances. So before I begin, what patients might be having some fluid electrolyte imbalances? Well, think about our burn patients, our trauma patients, patients that lost a lot of blood, heck, even our patients in heart failure, patients with SIADH. There's lots of patients that can have some fluid and electrolyte imbalances, and we're going to focus on a few, okay? If your patient is having a fluid volume deficit, they are very, very, very dehydrated. So, what are the clinical findings that we should recognize? Well, definitely some tachycardia, thready pulse, hypotension is a big one, and they're going to be pretty tachypnic. Okay, they're going to be breathing pretty heavily. Okay, we'll see other signs and symptoms such as dizziness, thirst, cool, clammy skin, etc. But what will we see in the urine? This is probably one of the best ways to know if your patient's dehydrated is looking at their specific gravity. Okay, the higher the specific gravity, it means that the more concentrated the urine is, meaning the patient is more dehydrated. Okay. On the other end of the spectrum, we have water intoxication. This is caused by fluid overload, which causes our body to be pretty diluted. The issue is when we dilute our sodium, I want you to think low sodium seizures. If your patient is so full of water, it's going to throw off that water to salt ratio. And instead of having a pack of Crystal Light in a cup this big and being able to taste the Crystal Light, you have one packet of Crystal Light in a swimming pool. Basically nothing. That ratio is so far off, and we're really concerned for seizures. Our signs and symptoms include big bounding pulse. You're going to have a hard time with auscultating and hearing things, and they're going to be pretty short of breath because all that fluid is building up in their lungs. Our goal for treatment for water intoxication is to put them on strict fluid restrictions and to start diuresing them. Okay. Also low, when I mean low water intake, they might be on 1,000 milliliters a day. Okay. Now we get to talk about nutrition for maternal health for all of our moms. So when we're talking about breastfeeding, they talk about moms needing to increase their calorie intake throughout pregnancy, but it's also important they still keep a calorie surplus during breastfeeding to help them continue to produce breast milk. So ideally, after delivery, if mom is planning on breastfeeding, we want to have about 300 to 400 calorie surplus, okay? Tips for breastfeeding that we constantly kind of forget about is that really during the day we want to when they're infants and they're newborns, we want to wake them about every 3 hours during the day and every 4 hours at night just to make sure that they are not dehydrated. What is the best way to assess for dehydration in the babies? We want to be keeping track of wet diapers, okay? If mom begins to express milk while the baby is sleeping and wants to save her milk, she can do so by refrigerating the milk. Okay. and then storing it either in the refrigerator or she can freeze it. If she decides to freeze it, we want to thaw the milk, but we never ever want to put it in the microwave. So just remember that. No microwave. When we're expecting some weight gain with pregnancy, those that start off with a normal weight should expect to gain about 25 to 35 pounds. Um, and really, it's just important you know kind of the relations. If your mom was a normal weight beforehand, she can gain a normal weight during. If mom was underweight before she was pregnant, we need her to gain more weight, okay? However, if your mom was overweight or obese, we don't want them to gain a lot of weight during pregnancy because it can put them at risk for other issues such as preeclampsia, could put extra stress on the mom, extra stress on the baby, etc. Okay? And really, we're kind of increasing our calorie surplus. We're growing a human, which is pretty cool. Additionally, we want to make sure we are eating high folate foods. Specifically, this helps prevent birth defects, specifically our neural tube defects. So, what foods are really high in folate? Lots of our leafy green vegetables, eggs, avocados, more of our fun citrusy fruits such as mangoes and papayas. Really identify those foods high in folate, or honestly, we kind of want them doing both, but also making sure that they take a prenatal vitamin because prenatal vitamins contain 800 micrograms of folic acid, which is going to help them. Okay. Our whole goal is reducing neural tube defects. If we had a mom who received no prenatal care, didn't know she was pregnant, we're a little bit concerned that she wasn't having enough folate in her diet. So as soon as we kind of recognize this, we need to get them on a nutritional plan. Okay. When we are bottle feeding an infant with a cleft lip, these babies have a really hard time with feeding, especially breastfeeding, so they will probably need a specialized bottle. So, in addition to that specialized bottle, we want to help squeeze their little cheeks while they're drinking because they can't do that on their own with the cleft lip. So, we're just going to squeeze their little faces. But if we do notice some signs of like respiratory distress or they're kind of like gurgling, kind of choking on it, we're going to immediately remove the bottle. Okay. And during the feed, it's still important to burp them during the feed. Okay. So just please keep that in mind. Okay. When we're thinking about what are some good food choices for a toddler, we're really focusing on safety, okay? While we do want to make sure that these kiddos are getting in a good diet, they usually are your picky eaters. Finger foods are usually best, but we have to supervise them during meals. We don't want them eating whole grapes, whole tomatoes, whole strawberries, or anything like that. We actually want to cut them up for the toddlers. They shouldn't be eating a whole hot dog. Let's cut it, you know, for them. Um, if we have a cheese cube, make sure you're cutting it into pieces that they can swallow. Okay. They're going to have a hard time with skin that's on fruit because, just again, choking hazard. So we're probably going to peel their fruits for them. Okay. Ideally, we want to make sure that we're not feeding them candy all the time, high fat foods, anything like that. But really, we're focusing on safety, reducing choking hazards, and also at least trying to get in a well-rounded diet for these kiddos because really they're picky. They might throw some temper tantrums. Usually they'll have the foods that they like, their mac and cheese, their chicken fingers, etc. So please just focus on safety considerations. So now we get to talk about weight reduction. So the reason we focus a lot on weight reduction is because it's got amazing health benefits. It's going to increase our life expectancy and decrease very some of our chronic disease that have a multitude of risk factors, such as cancer, heart failure, and chronic disease. Also, gout helps. Weight loss helps out with gout as well. Okay, so there's tons of benefits to weight reduction, which is why we want to educate our patient on how to safely lose weight, meaning not doing any fad diets, still making sure that they're getting in all their fruits and vegetables, they're eating high protein, low fat foods, etc. Ideally, we're going to reduce the fat intake. Ideally, we want 20 to 35% of our total calories coming from fat. So please remember, this probably has like our lowest percentage, 20 to 35. So low fat foods. What foods are high in fat? Anything that has been fried. Okay. So we want some skinless grilled chicken, some whole grains, oatmeal, etc. And that's going to help us drastically reduce our fat intake. Um, this kind of goes along with what we talked about earlier, but our saturated fats are solid at room temperature, meaning our coconut oil and our butter. These are very, very unhealthy. So we're going to try to opt for low saturated fats or low fat diets. How can we do this when we're just looking at a dinner tray? Kind of getting rid of visible fats, limiting red meat. We really want lean meats. And whenever we can, please avoid the fryer. Okay. Instead of using butter and salt, it's really important to maybe use some garlic herbs, things like that. Okay. How in the world do we calculate how many calories these patients should eat every day? Really, we got to think about fats contain the most calories, carbs contain a good amount, and proteins as well. But essentially, understand that the fat calorie calculation. We know that we want 20 to 35% of our daily calories to come from fat. Therefore, if we do the math, about 400 to 700 calories will come from our fat. When we're talking in the realm of weight reduction, it's really, really important that we eat low fat foods. So, no butter, we want low fat milk. We don't want to fry anything, etc. Okay. And finally, we're going to talk about our complete proteins. Essentially, all this means is that this protein has all 9 of the essential amino acids that we need. Okay. Our incomplete proteins will not have all 9 amino acids. Our incomplete proteins are common in more of our plant foods, and while they do contain a good amount of our aminos, it's just not sustainable. Okay. That's why the best choices for protein are going to be our meats, our eggs, our yogurts. Okay. Yes, there are sources of plant protein, but the bottom line is it's not enough for good, adequate protein synthesis. Okay. So just keep that in mind. And that is all I have for your guys' review. So without further ado, we are going to